When we go about managing something, we need to know exactly what it is that we're managing. In this video, I'll be talking about what most leaders in the myopia management world would consider to be the best and most accurate measuring stick for monitoring myopia progression, and also gauging how successful a treatment is. This is what we call the axial length. Hey everybody, my name is Dr. Natalie Chai. This channel brings you the latest science-based education and treatments in dry eye disease, myopia management, and specialty contact lenses to help you understand why it should matter to you for optimal eye health, function, comfort, and even beauty. For a very long time, optometrists predominantly monitored myopia progression by only looking at how quickly a child's prescription was increasing, maybe every 3, 6, or 12 months. While this is still a very widely accepted method, the paradigm is slowly shifting towards monitoring and managing the axial length of the eyeball. So what is axial length? Axial length is the distance between the front part of the eye to the back part of the eye. Remember, the primary purpose of myopia management is to decrease the risk of developing potential eye complications secondary to actually a long eyeball. We know through studies that axial length is the most significant contributor when it comes to refractive error or the prescription. If left unchecked, it could lead to significant vision loss and even blindness. Don't get me wrong, yes, it is awesome and definitely nice not to have thick glasses or lenses with having a high prescription. However, monitoring the prescription is really only half of the story when we're talking about managing myopia. So what is a normal eyeball for a child? There's always such a huge variation so that there's really no absolute value, but instead we can talk about it in percentiles. Most people understand this term because it is also used when describing other growth factors such as height and weight. Typically, the axial length increases from around 16.8 millimeters in infancy to 23.6 millimeters in adulthood. The expected yearly change in axial length for an emmetropic child, so a child who doesn't require glasses, under the age of 8 is around 0.2 millimeters. In contrast, the myopic child has demonstrated an annual growth of about 0.34 millimeters per year. This is expected to slow down in both populations as they grow. As you probably have guessed, the Asian children have generally demonstrated faster rate of increase when compared to their Caucasian counterparts. So here's an awesome graph from a recent study in 2018. This graph compares axial length to age. And the one on the left is for the males, and of course the one on the right is for the females. The bold line in each one of them represents the 50th percentile for axial length increase. In summary, and to make it super simple here for you, the children who are found to be below the 50th percentile is significantly less likely to become more myopic or become myopic compared to those above the 50th percentile line. When we talk about what is normal, it is very different between race, age, and even the child's baseline prescription. So this graph has really helped myself and a lot of other eye care professionals to match patient age, their refractive error, and their axial length to a predicted outcome. There are other important takeaways with axial length. The first is that the data suggests that we see changes in axial length way before and firstly before changes in prescription. The second, as we all know, is that axial length is associated with significant eye disease risks such as myopic maculopathy. One of the greatest questions researchers and clinicians have asked was if there was a relationship and correlation between axial length with the prescription changes of the patient. For example, if a child's myopic prescription increased by, say, minus 0.75 diopters, are we able to confidently know how much longer that child's eye grew? There's a lot of variability in the literature, but based on recent data, we can generalize that with every full step or 1 diopter change in prescription equals roughly 0.3 millimeters increase in axial length. Or in other words, with every 1 millimeter change in axial length independently, it would result in a shift of approximately 2 to 2.5 diopters. However, again, this is not an absolute one-to-one correlation, and we always need to be careful as these are really only guidelines at best. But by knowing this estimation, it does make a lot of sense that by using axial length changes is more sensitive and accurate than monitoring changes in someone's prescription. Measuring axial length is not mainstream in myopia management at this time. However, as I continue to study myopia management, including axial length, I recognize the importance of incorporating it as a necessary element to my protocol for my patients. There are many different ways to measure axial length, but when it comes to a kid, we're talking about looking for something that is quick, easy, and also non-invasive. Now, this method is called optical biometry. Here at Precision Eye Care, we have the IOL Master 500. The IOL Master is usually found in an ophthalmologist's office to help with an intraocular lens or IOL calculations when it comes to cataract surgeries. I specifically chose the Zeiss IOL Master for axial length measurement, as it is the gold standard in optical biometry in ophthalmology. There are a lot of different types of instruments out there that are just as good. This fancy instrument measures a whole lot more than just axial length, so it is a little bit of an overkill, but hey, what's most important to me is accuracy and reliability, providing the evidence-based, state-of-the-art technology for managing my patients. What's super impressive about the Zeiss IOL Master are the specifications. It measures the axial length range from 14 to 38 millimeters to an accuracy of 0.01 millimeters. Not to mention that this is quite easy for the child, and it is fast and easy for the operator to use. In my protocol, I will take baseline axial length measurements for my patients when we meet together the first time to do our workup. Studies have suggested to take repeated measurements every 6 months to monitor for any changes. The IOL Master is positioned to help in the initial risk factor analysis and is an excellent way to monitor if the chosen myopia management strategy is effective in slowing the progression. Progression is not only demonstrated just in the change in prescription over time, but we know it is also the change in axial length. There was a fantastic article by Debbie Jones that really drove the point home for me, where she proposed that we would only be doing half of our job in myopia management if we were only measuring, let's say, just refractive error, or if we were only measuring axial length. We arguably need both to obtain a complete profile of a patient over time. In the world of myopia management, there has been a long-standing and ongoing debate to whether it is necessary to implement axial length measurement in clinical practice. After investigating in the Zeiss IOL Master, I may know why it is not mainstream in optometry clinics at this period in time. The practice definitely needs to assess if having one in their office makes sense and align it with their future vision of their office. I am of the opinion it should be the gold standard of myopia management, and that at the very least, the optometric community should move toward having it as a necessity, especially for those who say they are serious with myopia management. In saying that though, I've been on the other side where I was only using refractive error as my measuring stick, and I still had great success. So I'm also someone who believes that it is always better to do something even when you don't have the fancy equipment than to do nothing at all. So if you couldn't tell by now, I'm pretty excited and happy to finally have this new toy in my clinic. Sure, I see it as a business investment, but ultimately this is an investment in the future eye health of our tiny humans. That's it for me. I hope you found this as interesting as I did when I was learning about axial length myself and its importance to myopia management for our children. Hey, if this is your first time to the channel and enjoy learning about topics like this, make sure to subscribe to the channel and click the notification bell to make sure you don't miss a new video every Thursday. Thanks everybody, take care of your eyes, and we'll see you next time.